Hey guys, this is Dr. Hub. Today we'll look at the renal diseases and we are going to discuss their glomerular pathology. So to begin with, first is the nephritic syndrome. So under the nephritic syndrome, there it includes the post-infectious glomerulonephritis. There is post-infectious glomerulonephritis. So how does it appear in the light microscopy? So in the LM, that is a light microscopy, it appears as a diffuse endocapillary proliferation. So there is a diffuse endocapillary proliferation, and there is also leukocyte infiltration. Next is the fluorescent microscopy. So here there is a granular IgG. There is a granular IgG and a C3. They are present in the globular basement membrane and the mesangium. So they are present in the glomerular basement membrane and also the mesangium. Then what are the others? In the fluorescent microscopy, it also includes the granular IgA, and these are present in some cases. Next we move on to the electron microscopy. So this shows the sub-epithelial humps and also the subendothelial deposits. So there is a subendothelial deposits. So they are present in early disease stages. Next we move on to the Goodpasture syndrome. So here the light microscopy, it shows the extra capillary proliferates. There is the extra capillary proliferates and they are present with the crescents. So the presence of crescents as well as the necrosis. Next we move on to the fluorescence microscopy. So in terms of the fluorescence microscopy, what is present? So in fluorescence microscopy, it includes there is a linear IgG and also the presence of C3. There is also presence of fibrins. These fibrins are present in the crescents. Next we move on to the EM. EM stands for the electron microscopy. So under the electron microscopy, there are the linear deposits, the presence of the linear deposits, and this is along with the basement membrane, as well as there are disruptions present in the GBM. GBM means the basement membrane. Next we move on to the IgA nephropathy. So IgA nephropathy is also known as the Berger disease. So as for the IgA nephropathy, what are the? In IgA nephropathy, the light microscopy, it shows. So it shows a focal mesangial proliferative glomerulonephritis. So it shows a focal mesangial proliferative glomerulonephritis as well as presence of the mesangial widening. Next we look at the fluorescence microscopy. Under the fluorescence microscopy, it shows IgA plus or minus IgG. There is also IgM and C3. C3 is in the mesangium. Next, we move on to the electron microscopy. Upon electron microscopy, there is the mesangial and parenchyma, paramesangial. So there is mesangial as well as the paramesangial. This will be the dense deposits. Next, we move on to the Alport syndrome. So in the Alport syndrome, it includes, there is a normal light microscopy findings, as well as there is the fluorescent microscopy. Then when we move on to the electron microscopy, it shows presence of the basket weave appearance. So there is basket weave appearance. So basket weave appearance is of the GBM. Then we move on to the nephrotic syndrome. So in the nephrotic syndrome, it includes a membranous nephropathy, MN. So here the microscopy, the light microscopy, it shows the diffuse capillary wall thickening. There is a diffuse capillary wall thickening, and there is also the granular IgG, and this is a light microscopy. Then fluorescent microscopy, there is the granular IgG and C3, there is diffuse. Next, when you look at the electron microscopy, it shows the subepithelial. The subepithelial deposits. And what does it include? It includes the epimembranous spikes. Epimembranous spikes, and there is effacement of podocytes. There is effacement of the podocytes. Next, we move on to the minimal change disease. So in the minimal change disease, the light microscopy shows a normal or turbid in tubules. It is normal, and it is the lipid in tubules. And let's look at the fluorescent microscopy. Our fluorescent microscopy, it becomes negative. Next, we look at the electron microscopy. Electron microscopy, it shows that there is no deposits and the effacement of podocyte is seen. Next, we move on to the focal segmental glomerular sclerosis. So focal segmental glomerular sclerosis is nothing but the FSGS. So here we look at the microscopy, that is the light microscopy. Under light microscopy, there is a glomerular hyalinosis and sclerosis. So there is glomerular hyalinosis as well as the sclerosis. And then comes the fluorescence microscopy. In FSGS, the fluorescent microscopy, they show the occasional There's occasional C3 and the IgM. Occasional C3 and IgM deposits, and these deposits, if you see, it is present in the sclerotic areas. So it is present in the sclerotic areas and the mesangium. Next we look at the light microscopy. So under the light microscopy there are no deposits. So there are no deposits, there is effacement, and this is the podocyte. Next there is also the epithelial denudation. So there is epithelial denudation. Next we move on to the nephrito-nephrotic syndrome. So in the nephrito-nephrotic syndrome, let's look at the membranoproliferative glomerulonephritis, MPGN, and you're looking at type 1. So here, upon the light microscopy, there is a mesangial pattern of the proliferative glomerular GBM. There is a mesangial proliferation of the proliferative pattern. So this mesangial proliferative pattern, and this is of the proliferative GBM. This is of the proliferative GBM, thickening and splitting, as well as the splitting. Next, we look at the fluorescence microscopy. So fluorescence microscopy, there is C3, there is C1q as well as C4 deposits. So C3, C1q and the C4 deposits, and there is also the IgG deposits. Then we move on to the electron microscopy. Upon electron microscopy, it shows the subendothelial deposits. Next we look at the dense deposit. So dense deposit disease, and we look at the MPGN type 2. So what happens here is that in the light microscopy, it shows the mesangial proliferation. There is a mesangial proliferation, and the pattern is of proliferation, the GBM thickening, as well as the splitting. Now let's look at the fluorescent microscopy. It shows the presence of C3. There is C3 deposits. There is no C1q and C4 deposits. There is no C1q and C4 deposits. Then there is no IgG deposits. So the C3 deposits, there is no C1q deposits and C4 deposits, and there is no IgG deposits as well. So only C3 deposit. And let's look at the electron microscopy. Upon the electron microscopy, it shows the intramembranous dense deposits. There is intramembranous dense deposits. Next, we will look at the fibrillary glomerulonephritis. So as per the fibrillary glomerulonephritis, let's look at light microscopy. So here there is membranoproliferative or the mesangioproliferative patterns, and there is also the presence of, this is in terms of there's light microscopy, and now we are looking at fluorescent microscopy. So there is the IgG4 and the C3, they are present. Then looking at the electron microscopy, It shows the fibrillary deposits. There's fibrillary deposits, and they are present in the mesangial and the capillary walls.